Here in North Carolina, new numbers just released. Take a look. 3,426 cases here in North Carolina, 2,417 down in South Carolina. It comes as this pandemic is affecting African Americans at a disproportionate rate. We're going to take a look at why that might be. Thanks for joining us here for the news at noon. I'm Ben Thompson. Well, despite some of those grim numbers, there is some promising news. It seems like social distancing is in fact working. New predictions show less people may get sick or die than previously thought. But officials say we need to keep it up. WCNC Charlotte's Richard Devane has more on changes Mecklenburg County is making to keep all of us safe.
Yeah, good afternoon. Looking at the latest projections, there are some good news that has the hospitals in our area now making some changes.
Starting now, you can only walk to Mecklenburg County parks, not drive there. Gates will be closed, and if you park your car outside, county leaders say it'll be towed.
These actions are the final step before we take aggressive action to close our parks and greenways.
The commissioners made the decision after another weekend of some residents not practicing social distancing. However, the stay-at-home order seems to be slightly working, alleviating stress in our local hospitals.
It appears that the social distancing taking place to date in the county has begun to flatten the curve slightly.
Now, instead of a 3,000-bed mass care facility at UNC Charlotte, local hospitals say they only need about 600 additional beds. Reasons for the dramatic reduction in beds: the fact that FEMA nor the state will help pay for the field hospital. Atrium and Novant made more room at their hospitals. Their CEOs saying a possible new location could be on their own campuses.
That does not mean we are out of the woods yet.
Hospital officials say while this is good news, they want you to continue those good safety precautions, keeping your social distancing practice in place, as well as constantly washing your hands or using hand sanitizer. We're outside of Atrium Health. Richard Devane for WCNC Charlotte.
Richard, thanks. Last week, WCNC Charlotte showed you how this pandemic is really impacting African Americans at a disproportionate rate, accounting for more cases and more deaths. And here in Mecklenburg County, African Americans make up about 33% of the population. But according to the latest data, they make up about 44% of confirmed cases here. NBC's Blaine Alexander has more on what is nationally a disturbing reality.
As coronavirus tears an unforgiving path across the country, numbers show it is especially devastating to one group, African Americans. In Chicago, nearly 70% of virus-related fatalities are black, even though African Americans make up less than a third of the population.
It's stunning. It is a red alarm, an alert that we've got to respond to.
In the epicenter, New York City, 59% of deaths are in Queens and the Bronx, both areas with high black and Hispanic populations.
We're working very hard on the African American community with respect to what's going on because it's not good. I don't like it.
Down south in Louisiana, African Americans, who only account for 32% of the population, make up 70% of the state's deaths.
Those hot spots are in areas of the state that have a disproportionate number of African Americans living there.
Not every state reports cases with a breakdown by race. The White House task force says the federal government is now collecting that data.
It will be public as soon as you get enough data to be able to make a meaningful statement.
Why is the black community getting hit so hard by this?
Well, the black community has been hit by poor health for a long time. Now you compound it by this deadly disease. I mean, it's no surprise that we're going to get hit harder.
Especially hard in smaller communities like Albany, Georgia. In a county nearly 70% African American, it has more deaths than anywhere in the state. Terica Parks is a survivor.
I was wrapped in a blanket. I'm laying there gasping for air, and all I'm thinking is, I don't think I'm going to make it.
People are scared. We're scared. We've never seen anything like this before.
And in addition to the underlying health conditions, there is another factor. A higher number of African Americans have jobs that require them to work during this pandemic. So positions like janitors, bus drivers, or grocery store clerks. So sheltering in place is not an option. In Atlanta, I'm Blaine Alexander, NBC News.